Member for Abitibi-Témiscamingue. Thank you very much, Mr. Speaker. I'm really happy to rise in the House to speak to Bill C-523, which was tabled by my colleague, the member for Saint-Bruno-Saint-Hubert, and which would reform the Department of Health Act, and which would allow us to better fight against drug shortages. Mr. Speaker, I am a nurse, and I practice as a nurse to keep my license. I work a couple of times a month in the emergency department and in an intensive care unit. And we use specialized drugs that are absolutely essential to keep people alive in those hospital departments. And that's why I'd like to say that it's absolutely essential that we find a better solution to deal with drug shortages. A drug shortage complicates things immensely for hospitals. Hospitals have to deal with many problems already when there's not enough beds, when there's not enough staff. Hospitals are dealing with many, many issues, and so if we add a drug shortage on top of that, well, that makes it very, very hard to administer health care, and sometimes a drug shortage means that operations have to be canceled. Recently, we had a shortage of certain injectable medications, and as a consequence of that, a number of non-essential, non-emergency operations had to be canceled so that we had enough drugs in stock for any emergency operations. And the federal government's inaction in this file has had a direct effect on patients who have had to change their treatment, who have had to change medication while waiting for a shortage to be resolved. For example, when it comes to mental health, maintaining a balance between symptoms is very, very hard to do. It's a very exacting science, trying to find the exact right mix of drugs, of medication that will allow a mental health patient to be in good health. And if one of those drugs is in a shortage situation, if another drug has to be used as substitution, that can lead to an imbalance. And in some cases, that can lead to psychotic episodes. So it's important that we understand the grave effects of drug shortages on our healthcare system. And the inaction of this federal government on this issue is hurting the provinces. The provinces have to measure these situations on their own individually, and that leads to a number of very complex solutions. So this reform is based on two main principles. First of all, mandatory reporting by drug providers if they expect a shortage. And secondly, the implementation of an emergency plan to deal with shortages. It's important to understand that drug shortages are a public health issue. And this isn't a problem that exists only in Canada. It's something that we see around the world. These are global companies, so countries around the world have to deal with drug shortages. In the United States, what the government there has done has put in place a mandatory reporting requirement for drug shortages. And the legal framework there is very clear. 195 shortages were prevented in 2011 and 2012 alone. The Food and Drug Administration, the FDA, is the central clearinghouse for information on drug shortages, and it adopts an action plan when there's a shortage, so it's ready to act. And since the FDA has put this policy in place, the number of shortages that have been avoided has gone up constantly since 2005. Between 2005 and 2010, roughly 100 shortages were prevented. And as I said earlier, in 2011, and 2012, 195 shortages were prevented. So it's incredible how simply putting in place effective legislation, which is a simple thing to do, has made it possible to avoid major problems that could have a critical effect on the health of members of the public. And I think that by following the example of the United States and of a number of countries in Europe that have put in place similar plans to deal with drug shortages, Health Canada should be able to change the regulation in this country to allow it to better deal with the causes and the consequences of drug shortages. If we look at the current Department of Health Act, we see that there are two problems in there. First of all, drug shortages are a public health issue because patients don't have access to the drugs that they need for their treatment. So that can lead to a number of situations such as I explained earlier. In some cases, patients will need to buy substitute medication, which is often much more expensive, and that can have a financial effect on the patient. And also, changing drugs can have a bad effect on the health of the patient, and in certain cases could lead to the death of the patient. So, the minister and the department's inaction could lead to, at the end of the day, deaths here in Canada. That's a fact. And it proves that we must act. We need to do something. A second problem is the budgetary issue. It's a financial issue because a drug shortage adds to the operating costs of our healthcare system. The healthcare providers have to adapt treatment for patients. They have to get in touch with the patients. Certain drugs, for example, if you're changing drugs, require blood tests. When certain substitute medications have to be used, a nurse has to follow up with the patient over a period of time to make sure that the medication that is being used is working properly and that it isn't causing any harmful effects. So we find ourselves in a situation where we need to monitor the clinical situations of patients. That represents a major cost for the healthcare system, and these costs caused by drug shortages must be paid by the provinces. So this bill, C-523, deals with these two problems, and it finds solutions to the issues raised by drug shortages. So, from a legal point of view, as I was saying earlier, drug companies would absolutely need to disclose possible, potential, or probable drug shortages. And those can be caused for all kinds of reasons, a spike in demand or supply chain issues. So it's not hard for the big pharmaceutical companies to warn people that a drug shortage is possible. And that would allow Health Canada to get the information out there very quickly to hospitals, to the provinces, to make sure that we can find an efficient solution to any drug shortage. This bill also requires the government, Health Canada, to have an action plan. We know that drug shortages can have a major effect on patients, so an emergency action plan is necessary. The last time we had a drug shortage in this country, we had an emergency debate in this House because the government didn't have an action plan. It wasn't ready for this kind of situation. It's absolutely unacceptable that we're not ready, that the healthcare system isn't ready to deal with a drug shortage. That's not a good way to make sure that we protect the health of Canadians. And that's why, Mr. Speaker, it's very important that we deal with this issue and that we support this bill and that we see it be passed as quickly as possible to protect the health of Canadians.
Resuming debate.